Today on the Dr. Oz Show.
The world of medicine is typically divided into two competing philosophies, Western and Eastern. But what if there were other ways to heal? On today's show, I'm going to introduce you to somebody who believes there are. He's a medical intuitive that's challenging the entire medical community with a unique proposition that says healing exists in the spiritual realm. And he claims we all have the power to diagnose and heal ourselves before disease sets in. Meet John Kortum.
Have you ever lost your keys and search all over, but you can't find them? Suddenly, you find that they're right in front of you, and you're astounded that you didn't see them in the first place? What if I could teach you how to see an illness on the body that's right in front of you, just like your lost keys? My name is John Kortum, and I'm a medical intuitive, and I can see your health problems before they're diagnosed. The body has a way of generating textural properties that relate to each of the organ systems, and I call these textural properties indicators. It began when I was about 8 years old. My parents were having a dinner party, and I noticed a man that had this dry aridity. And then shortly thereafter, I overheard my parents having a conversation, and they had said that this man had just found out he had been diagnosed with lung cancer. As I grew up, I began to realize that I was able to perceive people's health problems just by looking at them. The best way to describe how I feel with my eyes is we've all had the experience of listening to loud music, and we can feel the vibration of bass. And so as I'm looking, I also feel this vibrational or textural property. We all have this ability to perceive beyond our ordinary senses. And in my case, I blend my sense of feeling with my eyesight.
I've had psychics on the show before because I'm always so intrigued by their potential to help those of us in the medical community heal our patients. Now, John, you actually argue against the use of the words psychic and intuitive. You argue we can all actually do this on our own.
Yes, that's true. My experience of exploring the human senses is that there really is no such thing as being psychic or intuitive, that there's our human perception and the ways that we've learned to apply or position our perception. For those people that we call intuitive or psychic, I say that they have only dug in the buried corners of the mind and the senses that the rest of us have yet to dig. And so the question becomes, how do we motivate other people to start digging? The way I do that is by showing the power of perception in industry, and specifically in this case, healthcare industry.
So how is it that people can start to see health problems in themselves or in others? I mean, what do you do? What do you see? What actually happens in your mind when you see somebody?
For me, I'm using my ordinary senses, but I blend my ordinary sense of eyesight with my sense of feeling. And so when I look at people, I perceive textural qualities, and these qualities relate biological information about the major organs and systems to me.
Okay. So I have a board here that we made. I think this might be a demonstration that can help make this a little clearer to a lot of folks. So explain to me, if I was to look at somebody, do I see these, or is this actually just a way of reflecting what you're saying?
You're not. I see the same thing that you see when you look at a human being. Mm-hmm. There's nothing unique or special about my field of vision. I don't see colors. I don't see auras. I don't look into the body like an MRI or an X-ray. I don't hear voices or anything telling me what's going on with you. I'm looking for very specific textural properties when I look at a person. The human body has generated this language of health that generates these perceptual qualities that relate to each of the body organs and systems. So, as you look at the sponge, for those of you here in the audience or those of you at home, how many of you are having the experience of this texture of the sponge without actually having to touch it?
Well, I know what it's going to feel like when I touch it, even though I haven't done it yet.
Okay. And the same with leather. We know leather's more coarse than a sponge. Glass would be of a smooth texture. Yeah. And then the sandpaper here is a rough texture. And so these are some of the qualities that I perceive when I look at people that gives me information about their health.
And once you've seen this with your ordinary vision, but can make these perceptions come alive for yourself, how do your diagnoses differ from the diagnoses that I might, as a doctor, be giving?
Well, I would say that a medical doctor speaks the language of science, and I'm speaking the language of the body. And oftentimes, these textural properties that relate to organ imbalance that I call indicators concur with a conventional medical examination, but oftentimes these perceptual properties occur before a conventional medical test or exam can detect anything.
So you can theoretically find potential problems before they come alive as real illnesses that doctors can diagnose.
Yes.
And you can help assess whether treatments are in fact effective.
Yes.
Right. Dr. Alan Tenzar is a podiatrist who uses John's techniques in his practice. Dr. Tenzar, I was very intrigued to have you join the show because I wanted to know how this might actually play a role in the healing of folks who are going to see more orthodox healers. So how do you incorporate John's techniques?
Well, as a podiatrist, my scope of practice is limited to the foot and the ankle. However, behind the sole that's in front of me is the soul of a human being in a certain state of health. So I will look for concomitant manifestations of diseases in the feet. For instance, if I see swelling or edema of the ankle and the leg, and I notice a thyroid indicator, I'll suggest to them to go follow up with their doctor to specifically get a workup for their thyroid.
It's intriguing, actually, because we do get glimpses of this in traditional medical training. We'll see subtleties about how a disease affects the appearance of a patient. We use words that describe this in our own vernacular, but not thought about it the way you've described it. So one woman has agreed to bring in her medical records in order for us to confirm John's technique. We're going to do it live in our studio. And without knowing her medical history or anything about her, John is going to reveal if he can see the health condition for which she has been diagnosed. So John, come on over. I'd like you to meet Jackie. John, welcome to Jackie.
Hi, John. Nice
Hi,
to meet
Jackie.
you.
So John, go ahead and do your typical evaluation you might be doing if you saw someone in your practice.
Okay, as I look at Jackie, there is a brightness to her eyes, so it tells me there could be some indication about her eyes. When I get to her respiratory, she doesn't have a dryness or an ashiness, or I might call it. If you think of salt and pepper being mixed together, so it tells me her respiratory system is okay. She does have a pressure pushing out from behind her eyes and her face. It tells me there could be some cardiovascular indication. Again, when I get into I do perceive a thickness with her, and it's a little lower in the tract, so it actually looks to me like it could be affecting both small intestine and large intestine. Okay? But pancreas, spleen, gallbladder, and liver function all seem okay to me.
Let me stop you there. What's your diagnosis?
I have celiac.
Celiac disease, which is, again, an illness primarily of the intestinal tract, the small intestinal tract.
Okay.
And are you being treated for it?
Well, I was diagnosed about 3 years ago, and I follow a completely gluten-free diet.
So explain to me what you specifically saw that tipped you off that she had an intestinal problem.
So as I look at her face, I perceive a density, a thickness, if you think of the composite of wet mud. Mm-hmm. Okay. Now again,
Wet mud.
Sounds great.
and the thicker it is, then the more the threat to the health imbalance it would tell me to the system. So right now it's not, it's not third degree, but there is that quality that I perceive.
So go ahead and complete the evaluation.
Okay, so as I look at Jackie, again, she doesn't hold her presence in her skin, tells me her blood is okay. If you, again, bring your awareness to her forehead, I feel a stillness, a quietness, so it lets me know that her neurological system is okay. And she doesn't have the glossiness that I often see with women that have reproductive issues. So it looks like that's okay for me as well.
So Jackie, can I ask you a couple questions?
Yeah, please.
We know what celiac disease.
Yes.
Let me go through a couple of these issues. Any concerns about heart issues?
Oh, it's funny that you mentioned that because last year I did have to see about 4 cardiologists for them to tell me ultimately that they're pretty sure I'm okay, but that nothing seriously was wrong for me to pursue anything. Okay. But it was definitely interesting that you mentioned that.
Again, I can't pretend to see the subtlety of it yet, but what I do want to do when we come back is try to get folks to understand this so maybe they can begin to do it for themselves. So again, what's the question? For me anyways, how does John do it? He says we can all do it, and he's going to show us exactly how. That's next. We're back with medical intuitive John Kortum. Now, John's about to show us how to use our own senses to detect and heal health imbalances in our bodies. So in order for folks to get started, what do they do?
So what I'm saying is that I can feel with my eyes, that I use my visual channel to perceive textures. Mm-hmm. So it's almost like touching with my eyes.
Okay.
And once you learn to do that, you can perceive textures in your fellow human beings, which tell me the information about their body organs and systems.
All right, so to learn how to do what John does, we're going to take a look at 3 images of women. Now, 2 of the ladies in each of these images has a specific health imbalance, and 1 does not. First up, the sign of thyroid troubles. So, what are you looking for? Here's a picture. Just educate us, and then we're going to try to reveal to folks who the person who's suffering from this is.
Okay, so as I look at these 3 women, the woman who's A does not have this thyroid quality that I identify, and the women B and C do have this quality that I recognize.
And that is correct. Yeah, it does not. I'm sorry, what is the quality specifically you're looking for in B and C that reveals they've got a thyroid issue?
When I'm perceiving a thyroid indicator, I would look into the cheeks of a woman's face, and I perceive it much the same as a sponge in your kitchen sink.
Sort of
if you
like
look
this.
Here, yes, it would look like this.
So you're envisioning a sponge on this high part of their cheekbone, like we would put it on this model.
Right here, yes.
Right. It's interesting because in Western medicine, when we go through medical school, we're taught with thyroid disease to look for a doughiness. I never thought about it as a sponge, but it could be like a moist sponge maybe. Just a fullness in the tissue caused by the thyroid because it affects every cell in the body. All right, what do you look for in breast problems? So here's again 3 women. Which of these women does not have a breast indicator from your perspective?
Okay, so as I look at these 3 women, the woman C does not have this quality. However, A and B do have this quality.
Again, that's the right answer. And again, what's very specifically, what is the quality you're looking for?
When I'm perceiving a breast indicator, when I look at a woman's face, I perceive what I would call a strain, like piano wire or string cheese. I perceive a vertical texture like that.
Sort of like this model again.
Yes, and so this is how I would perceive it. And it's not necessarily on the surface of the skin. I'm perceiving subcutaneously. I can feel beneath the skin as I look at people.
Okay, how about someone who's got digestive issues? I'll put 3 pictures up again. Which of these women does not have a digestive indicator? What are you looking for to figure out who is the one who's having the issue and who's not?
When I perceive a digestive indicator, I'm perceiving a darkness, a thickness, a density when I look at a woman's face. So in these 3 examples here, the woman in the middle does not have this thickness, this darkness, and the women A and C do have the thickness and darkness.
This is remarkable, that you can tell that from looking at people from the outside. That's the correct answer again. A and C are the ones with digestive issues. And again, please describe to me, we built a little model for you. It's a clayness, is that what's the?
Yeah, I might call it wet mud.
Wet mud, that's right.
Wet clay, seaweed. I just feel, it's almost like how you might feel a compromised digestive system might feel sluggish. It might feel swamped. It might feel thick, dense, clogged. Yeah. And I'm not saying that that's necessarily what they find when they do medical examinations of the digestive system, but that's how the body's language communicates it to me.
So I want everyone at home to find someone that they know in their lives and say, you look like mud. It's a digestive issue, and let go of it. It's enough. All right, up next, John's going to show us a simple test you can do by looking in the mirror. What's next? We're back with medical intuitive John Kortum, who's about to reveal an amazing technique that he says can instantly key you in to the health of your immune system. John calls it the lifespan moisture level. What is a lifespan moisture level?
Your lifespan moisture level is your body's biological power supply that it has to draw upon to sustain or prevail over a health imbalance. And the way that I perceive that is that when I look at people, they have a saturation of moisture in their skin. And so the way I rate a lifespan moisture level would be on a 0 to 100% scale, 100% being optimal, 0% being undesirable. But what's interesting is as I've worked with people who have been diagnosed with cancer, when I look at them and they have a good moisture level, I can say, you're going to be fine. You know, follow your treatment schedules and path if that's working for you. But based on your moisture, your body's letting me know you will prevail.
You know, when we evaluate people for surgery, we have a similar system. We don't call it the lifespan moisture level, but we call it the protoplasm. I mean, how much substance is there to allow them to get through surgery? So I'm intrigued. There's a metaphor for this that you've created, which is it's called the spectrum of lettuce. So we've got 5 heads of lettuce here, just explain how this works and then tell me which one I am. What head of lettuce am I?
You want me?
I'm curious.
All right. Well, we can start here. This would be, a very moist head of lettuce. So this would be what I would call 100% moisture level. And I will say too, rarely do I encounter a human being that has complete 100% moisture. Most people are 80 to 90%. That's what I often see. So this would represent more of an 80% moisture level. Okay. This moving down to a 70% moisture level, and you begin to see how it's becoming less saturated, less full. When people move below 50%, and we start getting into lower levels of moisture.
This is a sad piece of lettuce here.
This is when I would get concerned about their health, especially if they are facing a challenging illness or disease. The lifespan moisture level is going to tell me how the body is going to handle that.
Let me make it easier. Am I more or less than 50?
You are more than less than 50. I'm going to give you
good.
Nice 80% right here, Dr. Oz.
Okay.
All right? All right.
Again, I just very hard, although I'm trained to look at people and try to evaluate whether they can undergo a massive operation. I've never really been able to quantitate it, and it's very difficult to imagine this exists out there, a way of, obviously it's not true moisture in the body we're looking at, because that doesn't change that much from person to person. It's a sensation you're having of moisture, right?
It's a perception, yes.
So, if you have low moisture, can you revive your lifespan to take it back to where you want it to be, back towards this arguably robust level of moisture?
Yes. And so, for example, with digestion, if you find that you are holding on to negative feelings from the past or holding on to grudges from a long time or not letting life flow through you, if you can work on that and at the same time be conscious of the kinds of food that you put in your body so that your absorption level is operating at an optimal level, that is going to restore lifespan moisture level.
You tie together very different things that affect our lives. And again, I started off this whole show talking about East and West, and this is a whole different path. In fact, there are many other paths I think we will find in healing. I've got to do some homework on these ideas, but they're very stimulating to me. Thanks for joining us. All right, up next, a brand new report